I think there's a lot in the media about 3 people I'm thinking of right now. One is, I think it was Chris Hemsworth was diagnosed with the gene that he may be at greater risk for Alzheimer's. And I know that Bruce Willis has, I think, vascular dementia. Is that right?
He
And
has a Yeah, he's a form of frontotemporal dementia. I'm happy to kind of chat about that too. That's a good one, yeah.
this is Dr. Laura. Welcome to Mind Candy Podcast, where we empower women's voices and tackle current issues related to psychology. Hey everyone, welcome back to Mind Candy Podcast with Dr. Laura. Today I have an awesome guest. Her name is Dr. AmberRose Reale. She is a clinical neuropsychologist, and she is going to talk to us today about all things neuropsychology and all about brain health. So go ahead, take it away.
Great. Yeah. So I'm a clinical neuropsychologist, and basically that means that my job is to work one-on-one with patients in more of a clinical setting to evaluate for any neurocognitive or cognitive disorders, things such as dementia, stroke, brain injury, Parkinson's disease. Basically, anything that can happen to the brain to make it not function properly is something that I can evaluate for with paper and pencil based tasks. There are experimental neuropsychologists that focus more on research. And so the main difference there is that I'm actually working one on one with patients to do evaluations. I love it because it's very nerdy and all about the brain. And there's a lot of great research in neuropsychology that shows a very high correlation between our tests and brain functioning. So it's a very minimally, if not completely non invasive way to evaluate for cognitive functioning. We can do it. There are pediatric neuropsychologists who focus on evaluating children for things like autism, ADHD, developmental delays, and then adult and older adult, which is what I do, which focus mainly on what I mentioned before, which are dementias, brain injury, stroke, Parkinson's, anything like that. And so my job is really trying to figure out, usually in the most basic way, if there's been a change, if there's something that's happened to the brain, either externally or internally, that's caused a change in how our brain is functioning. My job right now is in an older adults clinic, so I do a lot of evaluations with dementia. So we get a lot of older adults, which is anyone over the age of 65, who has had a change specifically more so in memory. And our job is to assess, is that change normal aging or is there something more going on? So our evaluations tend to be anywhere from about an hour and a half to 3 hours long. It involves about a 30 to 45-minute initial intake interview where we just get a lot of background information. We don't want to say something has changed when it's just something that's always been a difficulty for you. So it's good and very important for us to get that background information. And then, anywhere from an hour and a half to 2 hours of actual paper and pencil based tasks that look at memory, language, attention, executive functioning, processing speed, emotion, all of those different factors, all the things the brain can do. And from there, we can kind of compare it to normative data. So, what do we know about what the brain normally can do and our normal levels, and what is our individual patient experiencing? And we take that with the background information and kind of combine it to make it one whole picture of that specific patient. And then we can provide specific recommendations and guidelines based upon strengths and weaknesses.
Awesome. So, for our listeners listening in right now, I think a lot of people have a misconception about what a lot of things are because of what's on, social, not because they don't know it, but because of, what social media says, what, people in the media, all those like medical shows, and
Mhm.
they may not have a real idea of, what dementia actually is. So, Dr. Raleigh, what is dementia?
Sure, yeah. So dementia is a very broad umbrella term. It's also called a major neurocognitive disorder, which is my preferred terminology, just because I think dementia has a lot of negative connotation to it. But basically, it's a big umbrella term, and it covers a lot of different subtypes. So Alzheimer's disease is the most prevalent of all of the neurocognitive disorders. Then we also have things like vascular. We have mixed types of dementia. And so dementia is a broad umbrella term, and it basically means that there is a change in cognitive functioning beyond what we would expect just for normal aging, but it's also impacting very basic daily functions. So things not no longer being able to manage your finances, no longer able to make your meals because you're leaving food, you walk away, you forget, it's now burning. Very basic day-to-day activities, needing help sometimes getting dressed in the very severe cases or end stages. And that's when it meets the criteria for a major neurocognitive disorder. but we also have mild neurocognitive disorder. And that's when we're seeing changes in cognition that are more so than we would expect for aging. But the functional day-to-day activities are pretty well intact. They're not really impacted. And that doesn't necessarily mean progression to a dementia or a major neurocognitive disorder, because a lot of other things can impact how our brains function. And so again, that's kind of part of my job, is to figure out, is this a change, and is this something that we can focus on and address and improve, or is it something that we think will worsen over time, which is where dementia really gets its kind of negative connotation, and the biggest difficulty we have in the field is that they do worsen over time. They're degenerative. They continue to get worse over time, and unfortunately, we don't have anything that stops that yet. And so that's really what dementia or major neurocognitive disorder is when it's a cognitive change, will worsen over time and will continue to worsen, and is unfortunately not within our control to stop.
I think there's a lot in the media about three people I'm thinking of right now. One is, I think it was Chris Hemsworth was diagnosed with the gene that he may be at greater risk for Alzheimer's. And I know that Bruce Willis has, I think, vascular dementia. Is that right?
He
And
has he's a form of frontotemporal dementia. I'm happy to kind of chat about that too. That's a good one. Yeah.
and then of course, I think we all kind of worry about our president not being okay, right? And my point is that I think these diagnoses that a lot of us don't know a lot about, right, have been starting to come to the forefront of media. And I imagine that you probably want to clear up some things about, what is dementia, is there a family link to Alzheimer's or anything like that? I'm curious what your thoughts on that are now that these disorders are kind of getting their kind of time to shine in the spotlight. I imagine you have some stuff to say about that.
Yes, yeah, absolutely. Those are all really great examples, and they're actually very interesting because they show different types of cognitive change. So, Bruce Willis has a form of what's called frontotemporal dementia, where we see a decline in language-based skills, and it's a completely different area of the brain that's initially affected than something like Alzheimer's disease, which is where Chris Hemsworth has shown to have found positive biomarkers. So basically, for those that are worried about Alzheimer's disease, or worried because they have family members who have been diagnosed with Alzheimer's disease and they're worried about their risk. First and foremost, the thing that I tell all of my patients, the familial version or the family inherited version of Alzheimer's disease is not as prominent as people expect. It's less than 5% of all cases of Alzheimer's disease are related to individuals' family risk. There are tests that can be done. And my understanding of what Chris Hemsworth, what he was tested for is what's called ApoE. It's a specific gene that increases the risk for Alzheimer's disease. And there's certain amounts of each type that you can have that can be protective or risk factors. And so his were, unfortunately, a higher risk factor. Does not by any means mean that he will eventually become have dementia or have Alzheimer's disease, but his risk is slightly higher. Again, those of you with family members who have Alzheimer's disease, it's less than 5% in the population who actually will go on to continue to have Alzheimer's disease. The earlier the onset of Alzheimer's disease or a dementia of any kind, that does increase risk. So that is something to keep in mind. That would just mean go get a baseline testing with your local neuropsychologist, get checked out just so we can see how things are, so that we can be more specific in noticing change over time. And then I know there's a lot of discussion in regard to our president and levels of cognitive change there. I will say that age is the biggest risk factor. So as we have any politician who's getting into their 70s, close to their 80s, we're going to notice cognitive changes. Independent of there's an underlying process going on or not, we will have these changes. I think that's honestly more interesting discussion is, we can't have a president until they're 35. We have an age, limit as a minimum, but why don't we have a maximum? Well, let's say, all right, well, you've done your duty. Thank you for your hard work. I think maybe 70, you could go ahead and just enjoy retirement. Let's maybe have a 35-year span. I feel like that's fair. But again, as we age, that's the biggest
Get a few
risk factor
terms in
for.
there.
Exactly, right? You've got your
Audit
time. You've got your time. But yeah, that's the biggest risk factor for dementia is age. And so the older we get, I forget the exact number now, but it's something insane, like 80% or 85% of people over the age of 90 will have some form of dementia. And it's just because our brains, just like our bodies, they age, and we just cannot our bodies are living longer and longer thanks to all these medical changes, but our brains are not able to
Catching up.
stay as physically healthy. Yeah.
What is something that would you think would surprise our listeners about dementia and the whole process of aging and things like that? What are some interesting kind of facts you've kind of accumulated over the years?
Mhm. Well, as much as it may be frustrating for people to hear, exercise and eating right are huge, huge things that are just so important in brain health and not just opinion. There's research. I mean, there's absolute research that shows that it does lessen your risk for dementias. There's specific diets that you should follow. Exercising 30 minutes about 5 times per week is the ideal amount of exercise. And just doing those two things can substantially lower your risk for cognitive change over time. So I think all the doctors harp on it and want you to do it, but I'm
There's a
biased
reason
and I
why.
think the brain, yeah, exactly. I think the brain really needs it. And those are recommendations that I provide to every single patient that I have, independent if they have change or not. I also think that the brain is just the most amazing organ that we have. I think that it's responsible for everything that we see, everything that we do, everything that was built, everything that leads to progress, everything that's happening around us is really because the brain, in some form or another, came up with that idea and executed it. And so, individuals who think they may not be book smart, well, that doesn't mean that they're not artistic. That doesn't mean that they don't have other things to offer. And so, I think understanding that brains and intelligence don't just mean necessarily education or necessarily a high paying job, right? It's more than that. And I think everybody has strengths and weaknesses. And I think that's really just beautiful about the brain.
That's really nice. I like that a lot.
Thanks.
What do you think if females listening specifically, we deal with a lot in our daily lives, right? We're kind of carrying around a lot of the, emotional weight of our lives beyond the cognitive, right? What are some ideas you have for them if they're wondering, like, okay, how do I keep my brain healthy? They're exercising, they're eating well, right? What other tips do you have? I know a lot of doctors say like do puzzles, like do things like that.
Hmm.
What
Hmm.
other ideas do you have for them?
Yeah, and so I think for anyone in general, right, thinking of your brain just like a muscle. If we don't use it, we lose it, right? And so doing things that are, I call it my Goldilocks level of interaction, because if it's too easy, your brain gets really, really bored and it's not challenging it. It's like lifting a pencil to try and gain muscle strength. It's not really going to do anything. But if we try to lift, 100-pound weight when we've never worked out before, that's also going to be really, really painful and not what we want. So we can't do things that are too difficult. We need something that's just mildly engaging and challenging to keep your brain active. I think that also, again, for everyone, male, female, and anyone in general, we want to continue to focus on mental health. And so, podcasts like yours, other podcasts, reading and focusing on our mental health is such a huge factor. You can go work out, you can eat healthy, you can get all the medical tests and stay as physically healthy as you can, but if you're not mentally healthy, if you're not managing all of your emotions and managing just stressors that we all deal with day to day, your brain will have slow down an issue. And I have patients that come in quite often that have cognitive changes, but they're not based on brain based changes. They're based on neurochemical changes and emotion and stress. And they're not addressing those. And I think that that's one thing, especially in our field in general with psychology, that we're fighting for every day is people to recognize that mental health, even though we can't necessarily touch it the way we can, blood work and cholesterol or anything like that, is still just so important. And so staying focused on staying mentally healthy and emotionally healthy is extremely important for anyone. And I
I
think
think
also, yeah, go ahead. Sorry.
I was gonna
I'll just
say,
keep talking. If you don't interrupt me, I'll just keep talking.
and I love it because you're giving such important information. I think a lot of us, a lot of listeners can relate. I know I feel this way a lot. Then when we have a lot on our plate, when we're climbing the corporate ladder, when we're in grad school, when we're, balancing kids and, in work and, our social lives and marriages and relationships, it's a lot. And I've had a lot of people come into my office and say that they feel like their memory's going. Like there's, leaving keys in weird places and like just forgetting things and feeling very overwhelmed. I'm hearing that that's what you're speaking to, is that, I think a lot of us worry like, oh my gosh, right? Like I'm losing my mind, right? I'm becoming so forgetful. And I wonder if a lot of people, especially women, worry about that in day-to-day life.
Absolutely, without question. We have a term that we use in our clinic that's called worried well. And we'll
Mm.
get patients that come in convinced that they have dementia or convinced that they have the beginning stages of a dementia, and they're 38 and they have 3 kids and they're a single parent and they're working 2 jobs to try and provide, and they just don't understand why they put their keys in the fridge. And they must have dementia. I put my keys in the fridge, I'm crazy. Well, no, 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 your brain is overwhelmed. So your brain has a lot of bandwidth, but it's not limitless. And so I always use it kind of as an example of, if our brains can handle a bowl full of water, and it's usually filled up 75%, but then we get stressed or things happen and our bowl turns into a cup. Well, we have the same amount of water, but now it's at 99%. So we have less room for more things to be added before it overflows. And so that stressor is what's kind of condensing our bowl into a cup. We've got to be able to find ways to say no and allow ourselves that balance of, well, this is my limit, this is my boundary. I can't do this because my brain will stop functioning properly if I take on too much, or if I say yes to too many things. And so, again, that's why I find it really, really helpful to have podcasts and therapists and individuals in the field of mental health to be able to focus on that and help with coping skills, because it's really hard. And not to speak for all women, but I'll speak for myself as a woman. It's really hard to set boundaries and say no, and to put yourself first sometimes. And especially when you have family that you care for and you feel like they need to come first. Well, sometimes they do, but it's just like that. I also use this example in my office is, if you're on an airplane and the oxygen masks deploy, you have to put it on yourself first, because if you don't, you will pass out and you will be no good to anyone if you pass out. It's the same thing with your mental health. If you don't put yourself first, sometimes you will be of no use to anyone else. So you're not being selfish. You're actually being very selfless by putting yourself first.
Those self-care techniques that
Hmm.
psychologists like me preach in our
Hmm.
offices every day. What I'm hearing is that you, as a brain expert, are saying, please do those things, because it's going to
Yes.
not only help your mood, it's going to help your brain functioning as well, which is
Absolutely, yeah. And to be a little more nerdy about the actual components of the brain that are affected, our frontal lobe is highly involved in emotion functioning, personality, decision making, attention, processing speed. And our frontal lobe is the first thing that's affected when we are emotionally distressed, when we're having poor sleep because we're emotionally distressed, when we're eating poorly because of emotional distress. And what happens is those very basic functions, like paying attention to where I put my keys, those are no longer important to your brain. Your brain is fighting for whatever energy and focus it can get. And that's the first thing to go. And so our brains are not paying attention, and we assume I'm having memory issues. I have dementia because I can't remember where I put something. Now, your brain is in fight or flight. It is in survival mode when it doesn't have enough to go around. And so, really putting in that mental health focus and setting those boundaries and taking some time for yourself, it's actually changing or affecting brain based behaviors. So, it's
so.
very important.
I'm also curious, for all my ladies and girlies listening, what are some differences between the male brain and the female brain?
Mhm.
What are some fun facts you can share with us today?
Yep. So there are definitely differences in the brain based upon size. Of course, men tend to be larger, and there are areas of their brain that are larger than females. So there's different brain structures that are different. But also a lot of time, and I know that you know this and will speak to it as well, I'm sure, in multiple episodes of your podcast, but our experiences can adjust how our brain develops over time. And so certain experiences that we have can have an effect on how areas of the brain function, on different things going way back to even, hunters and gatherers. Our brains are focused on nurturing and more empathetic kind of focus on things, whereas men are a little bit more driven by, let me find food for the family and not necessarily let me make sure everyone feels safe. I'm going to make sure that they have food on the table. And so our brains, as much as they have changed over time, have not evolved as much as maybe we would like to hope day to day. And so it takes a little bit more effort for some of some women to kind of back off on some of what we overly emote, and also try to have male brains pull out a little bit more of that. And so there's still a lot of things that we can learn from each other in regard to kind of working on moving forward with developing and experiencing things. That nature versus nurture argument, right? It's both, I think. And so making sure that we're really focusing on the nurture part of that as we're interacting with little boys and little girls, and helping them to grow and letting them know that you don't have to necessarily fit into a specific gender role. We can kind of have that be a little bit more fluid, and kind of understand that we have things that we can learn from all genders.
I agree. And I think that, it's really interesting to see, you talk about that because I see a lot of men come into my office and they're very solution focused. They're very
Mhm,
problem oriented. And tapping into those emotions is not only something that they're fairly unfamiliar with, but that they have been trained to not
mhm,
look to through society. And I imagine that has shaped not only their emotions, but their cognitive, neurodevelopment as well. And then with women, we tend to be much more diplomatic, right? Much more care in the caregiving role. And I would
mhm.
imagine that that's something kind of we were speaking to before, right? Which was, not totally being the only caregiver, right? Working on
Mhm.
ourselves as well.
Yeah,
Um,
absolutely.
my last question for you is if someone's listening today and they have someone in their life that they're worried about their memory, maybe a parent, a grandparent, a friend, what advice would you give that person of next steps? Where do you go for help? How do you find help from a neuropsychologist like you?
Yeah, so I think anyone who is concerned and are noticing significant changes in a family member, it can be really scary for the individual and for that family member. And so we do have a lot of individuals, unfortunately, who refuse to come see us because they're scared about it. And it's a valid feeling. But the
Mhm.
problem is that ignoring it doesn't, unfortunately, make it go away. Otherwise, I wouldn't have a job. We would just ignore it all the time. So the first and most important step, I think, is just trying to have a conversation with the patient, or with the person with the changes, explaining your concerns. If they really do start to get emotionally overwhelmed, I would say we want to maybe back away from the emotion, right? We want to say, okay, well, let's look at it this way. If you were having heart pain or chest pain, would you go to the doctor? Yeah. Okay. So we're just having some brain pain. Let's go check that out. Focus it more
Love
on
that.
that, make it a more health related issue versus something that feels intangible. And then you'll have to go chat with, I would suggest probably the easiest first route or first step would be your primary care doctor. Go make an appointment with them. They'll check blood work because there are different things in your blood that can affect cognition. So we want to make sure we rule that out. And then they can either, if we are concerned, start on certain medications to help with slowing memory progression. There's not a lot of negative side effects. Talk to your medical doctors. I am not medical, but there's not a lot of side effects that we know of from our medications. So that could be something that your medical doctor wants to start you on. And then they would refer you over to us. Most big cities have multiple neuropsychology offices. The smaller cities, you may have to travel a bit. I'm currently in Fort Myers, and we're one of only a few offices, and there's only three of us. So unfortunately, the waits do tend to be a little bit longer. So in the meantime, while you're waiting for your appointment with us, start exercising, start eating healthy, get better sleep, right? We want to make sure that we're getting restful and restorative sleep. We want to start doing those mental exercises, right? Like we talked about. So there's a lot of things that you can do even before you come in to see us. But I always think of it as just like blood work. We want to get a baseline. We want to just check in, see how you're doing. And so knowing that there is a bit of a wait, just go ahead and start with those initial things that we chatted about, because I promise when you come to see me, I will tell you to do all of those things no matter what. So just go ahead and
Be prepared.
get them started right away. Exactly.
Awesome.
Exactly. Yeah. Yep.
Awesome. Dr. Raleigh, thank you so much for your time today. I think
Thank you for having me.
we all benefited from this so much. I love the destigmatization of, brain health related problems. They can seem so scary and unsurmountable. So I think you really helped, kind of declassify that today and destigmatize it. Okay, so Dr. Raleigh has given me some awesome resources that I'm going to have attached to this episode for further reading with any questions. Don't forget to hit subscribe to Mind Candy, and I can't wait to see you all at our next podcast. Thank you so much and have a great day. This is Mind Candy with Dr. Laura. Hey everyone, it's Dr. Laura with Mind Candy. A quick note just to discuss, as I am an ethical psychologist, none of these subjects or the information in the podcast constitute any kind of therapeutic relationship. All of that information can be found in our terms and conditions. Everything we discuss on Mind Candy are the experience of myself and my guests, and it does not constitute advice or a therapeutic relationship. Thank you so much, and don't forget to hit subscribe.